Patients with acquired structural brain lesions, such as those with hypoxic ischemic encephalopathy, infections or trauma, are at risk of developing drug-resistant epilepsy. Often such patients are not epilepsy surgery candidates because their disease is diffuse or multifocal. This means that the clinician is left with medical approaches to their therapy. The ketogenic diet is a medically supervised diet which comprises high fat, low carbohydrate and adequate protein for growth and nutrition. It is typically given in a ratio of fat to carbohydrate plus protein of 3:1 to 4:1. The classical ketogenic diet has been shown to be effective for refractory epilepsies, particularly syndromes such as Lennox-Gastaut syndrome and epilepsy with myoclonic atonic seizures described by Doze. Indeed, responder rates where seizures have reduced by 50% have been shown in 65% of patients with Dravet syndrome and 55% of those with epilepsy with myoclonic atonic seizures.
We observed that 2 of our patients with hypoxic ischemic encephalopathy were seizure-free while on the diet. We hypothesized that patients with refractory epilepsy secondary to acquired structural lesions could be responders to the ketogenic diet. We have certain patients referred to the ketogenic diet clinics at Austin Health, Melbourne, Australia, and at Great Ormond Street Hospital for Children, London, UK. Of 61 patients on the ketogenic diet clinics, 9 had acquired structural epileptic encephalopathy. 3 months after the initiation of the ketogenic diet, 7 out of 9 patients were responders and showed considerable improvement. At 6 months after initiation, 6 out of 7 patients were responders, 3 were seizure-free, and 2 had more than 90% seizure reduction. After 1 year after initiation, 6 out of 6 patients were responders, 3 were seizure-free, and 2 had more than 70% seizure reduction.
It is somewhat counterintuitive that patients with acquired structural lesions and refractory epilepsy would be responders to the ketogenic diet. It is interesting that our responder rate of 78% is similar to that seen with congenital malformations and genetic encephalopathies such as those due to tuberous sclerosis.
The families also remarked significant improvements in development and quality of life, most notably alertness, calmness, and developmental improvements. Based on our study, the role of the ketogenic diet among patients with refractory epilepsy should be considered early in their treatment algorithm.
Early treatment for these patients with highly refractory epilepsy has the potential to improve both seizures and quality of life for these children and their families.